Good evening, everybody. My name is Suzanne Paulson. I'm the CEO and the founder of iEco, and I'm so excited for this evening. I am joined by the wonderful Dr. Jamie King, who you're going to learn all about. And we're embarking on this new series, which is an extension of something that we've been building for the last 6 months, actually back in October, really taking it regional. Many of you in the audience, and thank you for being here, may have participated in the 6 other series that we've done with the expert panel. These are some of the brightest minds in dry eye, scientific research, all kinds of things. And out of their work, and they're continuing, and this series too will continue, the expert panel series will continue. But overwhelming request for, can you help me as a patient, help me find a great dry eye doctor near me? And so that's the inspiration behind this series. And we're taking our elite winners, the people that are the top of the top in their game. That's Dr. Jamie King being one of them from beautiful Rockford, Illinois. Her practice is Advanced Rockford Eye Care. And Dr. King, welcome. I'm so happy you are here. And before we start engaging, just for everybody who's out there, as you probably know, we're going to have a Q&A at the end of this. It's going to be via the chat. If you have questions during the next 20 minutes or so, and you want to ask Dr. King some questions, and remember, we have to be careful. We're not giving out medical advice, but there'd be questions that would be related to the conversations that we're having, or we're going to address those at the end, and you can just put those into the chat section, okay? And hopefully you know where the chat is. They're in 2 different places there on your screen. I believe it's up on the top if you have a desktop, and on the bottom if you have if you're on a mobile device. But without further ado, Dr. King, welcome. I'm so happy you're here, and I understand you're Rockford. So some people might know where that is in Illinois. Where is Rockford in relation to Chicago, so people have an idea?
Right. So we're about an hour outside of Chicago. Not a bad drive, just right down 90. We have patients who come in from Chicago and the suburbs.
Awesome. Okay. And you're from Rockford? Are you from Rockford?
I'm from a small town right outside of Rockford called Belvedere.
Awesome. Awesome. So you can tell from, hopefully people have seen your video, the little trailer to start this off, and you can just feel your passion for dry eye. What was it when can you remember, what was the trigger, or how long ago did you discover that dry eye was really something that you need to be paying attention to in your practice?
Yeah, so in my old practice, we opened a new clinic about 6 years ago, and I can remember just the dry eye patients starting to trickle in, and it would usually occur at the end of an exam. And I'd hear a lot of, you probably can't help me, but, or there's probably nothing you can do about this, but, or this is probably just normal, but, and it was usually dry eye symptoms. My eyes burn, and they're dry, or they're itchy, or my vision starts to get blurry. So I felt like I started to get more and more of those responses from patients. And then I had one patient in particular, and she never initially came out and said her eyes hurt or felt dry or burned, but she was just visually frustrated. She had seen many other doctors, and her complaints were all vision related. Basically, she'd sit down to work. She worked on a computer all day, and vision was fine. And after 10 or 15 minutes, everything would blur. She had bought many pairs of glasses, like I said, seen many doctors. And so she sat down, and I knew it was going to be a tough patient right from the beginning. She said, there's probably nothing you can do, and she shared her story of all of her frustrations. And I thought, it's kind of like when you tell a kid, don't touch that. When someone says you probably can't do anything, you really want to do your best to try to figure this out. And this patient came in several times before I figured out it was dry eye. Dry eye wasn't really on my radar at that time. In optometry school, dry eye is treated with artificial tears. Dry eye was an older person disease. You put them on artificial tears and you see them the next year. So this really encouraged me to start digging deeper into diagnosing, treating, identifying different types of dry eye, and understanding that there are different types of dry eye. Not every type of dry eye responds to the same treatment. So you have to really identify that specific type of dry eye to have an effective or efficient treatment option for the patient. So I think that one particular patient, with all the other patients kind of trickling in, really just is what kind of triggered the whole dry eye
That's super. Yeah, that's a common thing that we've heard throughout the series too, is that for many out there listening, if you have severe dry eye, because of the advancements in the industry with diagnostic tools and the in-office treatments in particular, some things that weren't even available 5 years ago, really go listen in, because there are things that can help you now that weren't available even 5 years ago. But to your point, there's no reason not to. Don't wait that long. Go in there. We're going to get to some really fun patient stories. But so about 6 years ago, what percentage of your clientele right now do you think that the patients coming in have moderate to severe dry eye?
I would say 20 to 35%.
Okay. Are you screening everybody? Do you screen? Yeah, that's great. That's the other super trend. And do you find that most of your moderate to severe dry eye patients are symptomatic?
I think that I'd say the majority are symptomatic, but it's interesting that patients don't really often understand what a symptom of dry eye is. It's not always that it's dry. Like I mentioned before, it could be blurred vision, it could be painful, eyes that fatigue towards the end of the day. So, but I would say a fair amount.
Okay, very good. Well, we have two fascinating patient stories tonight, or case studies that we're going to go through. So we're going to dig right into that. I'll turn it over to you. I think these are the audience is going to love this patient success story. So the first one, let's hear about this one.
Okay, so this is recent. I would say in the last few months, I had a little patient, 8-year-old female, and she came in with her mom. They were pretty concerned, and they were referred by their pediatrician. So she liked to read, although the last year she'd been on the computer a lot more than normal, given our circumstances. And she had been diagnosed with allergies, eye allergies, by her pediatrician. Probably it had been going on about a year. And she was on an oral allergy medication. She was on a prescription topical eye drop for allergies. And while it seemed to come and go, it seemed to be worsening over the last year. I mean, even before I looked at her with any of our technology, I could visibly see her eyes were red. She was rubbing them in the office. She was teary and just red and inflamed. So she described it as they were itchy and sore. She didn't really have a medical history. She's a healthy young girl. When I looked at her eyes, I could see a few things that jumped out right away. She had blepharitis, which I like to describe to patients as just debris. Dead skin cells, bacteria, biofilm, everything kind of sticks along the lid. And she did have a lot of that, as well as Demodex, which is a little bug, kind of a skin mite that tends to live along the base of the eyelashes, and they're itchy. So when I asked her how they felt, and I could even tell this too, a lot of times with eye allergies, people will itch in the corners, and she itched along the whole lid. So she was kind of doing this, which patients often do with Demodex. And then we also have the capability in our office to view the glands inside the eyelid. And I was already seeing some mild shortening there. And I'll talk a little bit about that in a bit too. But so we did an in-office treatment. We apply a topical cleanser, and we scrubbed a lot of the skin mites off of there. We debrided her lids, which is a little instrument I use. It's painless, but I kind of scrape everything off of the surface of the lid that's not meant to be there. And then we sent her home with the advanced tea tree cleanser. She was using that twice daily. And we started her on some warm compresses with the Tranquilize Eye Eco mask because she was showing some early signs of meibomian gland dysfunction. So we had her come back. Oh, I also took her off of the allergy meds. We were kind of in the midst of allergy season in our area. So I was hesitant to do that, but I wanted to see if when she came back, she still showed no sign of allergies, and she didn't, even with taking her off of those. So she's doing really well. She'll continue to use those products. These types of conditions, you don't really stop treatment once it's better. You want to continue so we don't see any signs of them return. So
was there any issue with compliance with the age of 8, out of curiosity?
No, her mom said she did really well with the The dry eye treatment, the mask is very easy to use. The foam is very easy for kids to use. They just kind of rub it between their fingers and put it on their eyes and rinse it off. And I said she could do it in the bath or the shower. It was a really easy way to do that. So no, I don't think there was any issue with that.
That's wonderful. So that's a big change. Happy mom.
Yeah.
No
So
more drops.
no more itching. She came in really happy. Mom was very happy. She was happy that we took her off of a prescription medication that she had been on for a year and wasn't really needed for her.
For all those moms out there too that have children that are in this age group, younger children, Dr. King and I were speaking before we went live about the impact of COVID. And do you mind just sharing a little bit of what you've seen relative to dry eye and COVID with younger people in particular, but it doesn't really have to be, just the increase in the incidence of dry eye related to that?
Right. So a lot of us in the dry eye world, we know that there's glands along the eyelid and they're like little sponges. When we blink, we squeeze out this oily tear film, and that's what holds your tears on the eye so they don't spill over or evaporate faster than they're meant to. Well, what keeps those glands healthy? One thing is our blinking. When we blink, our eyelids come together, and that's kind of the motion that keeps those glands working. Well, when we're on computers, looking at cell phones, tablets, we don't blink as much or as complete. So those glands actually start to atrophy. So you think of this is a condition that's chronic and progressive. If you take a small child who's on a computer all day, they're starting to develop this atrophy at a young age. What is this going to look like when they're 20, 30, 40? So it's nice to be able to have these opportunities to educate young before this becomes the problem. But in addition to all the computer time, mask wearing that we know has contributed to styes, chalazion. But think of at least what I've seen in practice is increase in antidepressant and anti-anxiety medications that also can contribute to dry eye. So that's another increase that I'm seeing that's a contributing.
Yeah, the stress, like all the stress and people having to change their routines. Maybe can't exercise the way they were or take care of themselves because they were confined. So all of that out there goes back to echoing what we've seen in all of this series, which is really it's so dynamic and so complex that it's a function of your lifestyle, environment, and physical condition when you're looking at dry eye, as Dr. King is describing. And every person is different. And so that's why you really want to find doctors like Dr. King to have a customized treatment plan. So thank you for that, which I thought was just, when I saw page 8, I'm like, holy moly, this one's a little different. And this looks like a very complex case here.
Yeah, so this is very different. The first case, it's very targeted, an easy diagnosis, a targeted treatment. It's very effective. Patient 2 is the opposite of this, but what it does is it's an example that highlights how complex dry eye is. There is not one type of dry eye, and also dry eye can be dynamic. You might start to change someone or start to treat somebody who isn't producing enough water in their tears. You get that under control, and then you might start to see a whole other type of dry eye form. In this case, this patient had almost every type of dry eye that you can have. And like a lot of types of dry eye or cases of dry eye, you don't treat it and move on. This is chronic and progressive. This is going to take a long time to get a patient feeling better. And that's important for patients to realize, is that we don't always have a quick, effective treatment. If dry eye has been going on for a long time, it's going to take a long time to see improvements. In this case is a good example of that. So this is a 64-year-old male who is also in healthcare. He was actually referred by his cataract surgeon. He'd been wanting cataract surgery, and she kept deferring, mostly because she wants a good result. She wants to give her patient an accurate, precise result to his cataract surgery. Dry eye is our number one reason for remaking glasses. It's our number one reason for patients being unhappy in their contacts. So think of a cataract surgeon who's about to put a permanent lens inside your eye based on your glasses prescription. So in this case, I 100% agreed with her. And I have a big respect for surgeons who defer until this is better managed. But he came in pain level 8. eyes were uncomfortable, extremely sensitive to light. He was tearing. His eyes were really weepy and droopy because of the inflammation, but even with that, he had a hard time keeping his eyes open. He had go ahead.
I said, poor guy.
Yeah.
It's really we always talk about the quality of life, and how you can improve quality of life. Perfect example of here's the opportunity to do so.
Right. He had rheumatoid arthritis. So like you mentioned, Suzanne, there's usually, what's going on in the body can oftentimes present to the eyes. Inflammation, we know, is a huge part of dry eye. Rheumatoid is no exception to that, but he thought his rheumatoid was pretty well managed with his rheumatologist. He'd been to many other eye doctors. He came in with a bag of different artificial tear bottles. He had been taking Restasis, which is a prescription strength drop for dry eye. But every time a doctor would try to start him on the Restasis again, he said he could only use it a couple weeks before it would burn. And he said it would burn so badly that he couldn't open his eyes for 10 or 20 minutes. He was using what he thought was good lid hygiene. He was using a warm washcloth to do warm compresses, which we know is not an effective or the best way to do that. And he was using baby shampoo, which most types of baby shampoo, unfortunately, have a lot of chemicals in them that aren't safe to be used around the eye. So we discontinued that. But in any case, he was diagnosed with aqueous deficient dry eye, meaning he wasn't producing enough water in the tears, severe meibomian gland dystrophy. And I think we have a picture that I can show in a little bit. Blepharitis, so he had a lot of that debris along the lashes, Demodex, those little skin lash bugs, ocular rosacea, where you get these red vessels that carry inflammation in and not only make the eyes look red, but can start to destroy tissue. And then mucus fishing syndrome, which I didn't identify right away, but it's a condition where patients actually kind of dig and pull inside their eyelids, itch, and cause little scratches along the surface of the front of the eye. So initially, he just had a lot of redness and debris. So we did an in-office treatment to clean that up, debrided the lid line, and we expressed his glands. Later, he came in and we did a series of what's called an amniotic tissue membrane. And it's similar to a thick contact lens that is placed on a patient's eye to help the eye heal. It's a very successful treatment for a lot of types of dry eye. We did a tear care procedure where we apply an intense heat to the eyelid. Very comfortable procedure. Patients love it and oftentimes fall asleep. And then IPL, which is one of my favorites, it stands for intense pulse light. It's a treatment where we apply this light. It reduces inflammation that's going to the eyelids. It removes a lot of reduces the ocular rosacea as well as any facial rosacea. We did 5 treatments of those. That was very effective for him. We did triscleral lenses, which is a therapeutic lens that's placed on the cornea, similar to a regular contact lens. It provides clear vision, but also helps heal the cornea while you're wearing it. For him, this was not a good option because of the rheumatoid. He had some difficulty with his hands handling the lens, and he just decided it wasn't for him, but we tried it. Initially, for at-home therapies, we had him on the Eye Eco tea tree cleanser. We had him on a lid prep to clean the lids. He was doing warm compresses with the Tranquilize, which he really liked that too. We tried a lot of things. Doxycycline upset his stomach, and we had him on fish oil. Later, when we uncovered the mucus fishing syndrome and the scratches that he was kind of giving to himself, we talked a lot about how to stop fishing or stop digging in the eyelids.
There might be people that I think in the audience that aren't familiar with what that is. That's so it's actually they're so uncomfortable that they're rubbing really hard and putting their finger inside the eyelid. Is that what it is?
So oftentimes what prompts it is different types of dry eye where patients start going in to itch the eyes or pull out mucus strands. But then I think sometimes they do that without realizing it. But what happens is the fingers or the fingernails actually start to scratch the cornea. Wow. And looking back, that may have been why he was having such a hard time with the restasis. If his cornea was basically open wound, that can be pretty uncomfortable. So that was a big part of not only teaching to not do that and educating the patient on trying to stop that habit, but then just healing up the cornea.
And it looks like you put him on
Autologous serum. Yeah, so that's a good treatment option too. Basically, a blood draw is done, and they centrifuge it and remove different components, and they bottle it into an eye drop. That is an excellent treatment for some types of dry eye. And then once we had him healed, we did return him to restasis, and he did really well. And we got him on more preservative-free artificial tears, which are better for him in the long run.
Great. And then I see PRN too, which is one of the, it's a popular nutraceutical for improving the oil that's coming out of the glands now that you've freed everything up.
Right. So fish oil is really important for a lot of our dry eye patients, and specifically medical grade fish oils. A lot of the over-the-counter fish oils aren't very effective for our patients. So yeah, an important part of it.
Yeah, and here's your before after. Woohoo, your success story.
So yeah, basically we were able to get him to where he could open his eyes without feeling the discomfort or the photophobia, sensitivity to light. The picture you see here, so the second before picture, this is the imaging we actually do on most of our patients when we screen, and it's called meibography. It's taking an image of those glands inside your eyelid. So this is telling us if you're producing enough of that oil that holds your tears on the eye. And in his case, you can see he's pretty severe. The example is along the bottom. That's kind of our sliding scale from normal to severe, because as the glands clog, they actually start to die off and we get gland dropout. And you can see on the top image, that's his, he basically had not much left there. So pretty severe. And then the picture below that, you can see there's kind of this green stain along the upper lid. And that's staining cells that are damaged from dryness. So when your eye is so dry, what happens is you're blinking and those lids are just dragging along that surface. We call that lid wiper epitheliopathy. But basically think of windshield wipers on your car running all day, all night without it raining, and you're going to dull that blade and damage it. Unfortunately, we can't really replace our lids the way we can a blade. So that was another part that was causing a lot of the inflammation.
Got it. And then the after ones were, and I can't believe we only have 7 minutes left.
Oh,
This just goes too fast. It goes too fast.
So, yeah, and this is complex. I will tell you, not everybody is this complex, but in his case, what we were able to do, he still has a long, we're going to be treating him for a long time. But we got him to his goal, which was that he wanted to get cleared for cataract surgery. He was seeing blurry. He wasn't able to drive on his own. And we got him his main goal. We got him feeling comfortable. We got him cleared for cataract surgery. And that was life-changing for him.
That's amazing. And I think it's a wonderful story, because even the most complex, you can improve the quality of their life. I mean, that's it, just through the process of trying different things. Like you said, maybe one thing works and not giving up on it too. We've heard that before, that some people just want that quick fix, and you need to stick with it and stick with the routine so you can really give the body a chance to respond to it. So we have some questions here coming up. Let's see. What are your thoughts about using Regenerize for dry eye relief? I don't even know what that is. Regenerize.
It actually is in my my thoughts a lot. Probably the next treatment that we'll be adding, that I've been reading a lot about. I think the research is there. It can be very effective. And
those that might not know what that is, you want to share what that is with the audience?
Yeah, it's a drop that's made to help the cornea heal a bit better. I guess I would compare it to the bandaged amniotic lenses we use in a bottle. to put it simply. It's just a drop you put on that really helps the cornea heal. That should be available or is available, and some eye doctors do have it and are prescribing it. It's still fairly new to us, but yeah, I've actually been reading a lot about it.
Thank you. Another one, there's one from, do you have any suggestions for someone who needs IPL but can't tolerate the eye shields due to very sensitive corneas? Thank you for any help you can give me.
I would probably, is that coming from a patient or a doctor? Like
this is all patients. Yeah, patients.
Okay. I guess I would try to heal the cornea to where you can tolerate the shields. We sometimes, usually for my first IPL treatment I do for a patient, I don't use the shields that are a contact lens. I use the stickers that cover and protect the eye, so I can see how their skin is going to tolerate the treatment before I actually put the shields and treat the lids. So that could certainly be an option. I have some patients that don't want to do the shields at all. IPL is still effective. It's still going up to the lids. It's still treating the lid margin. It's still doing everything it needs to do. It might not do it quite as quickly, but there are patients that I treat that we don't use the shields on. I think you'd be fine.
Okay. Another one, what questions would you encourage patients to ask their dry eye doctor going in, or their doctor if they're a dry eye patient?
I think understanding what type of dry eye you have. That's important to have an eye doctor who understands there's different types of dry eyes, so they can provide you with an effective treatment, or a doctor that maybe doesn't specialize in dry eye, but knows where to send you. But I think knowing the type of dry eye you have is important. Okay.
After eyelid surgery, my eyes are slightly open when sleeping. Any advice?
Yeah, Suzanne has a great product. Of course, I'd have it evaluated by your eye doctor to make sure that's the only thing going on, because like I said, with most types of dry eye, it's usually a combination of different things. But
great advice.
There's a product called Eye Seals, which actually helps protect the eye while you sleep. Basically, when we're sleeping, our eyelids are meant to close all the way, and the cornea resurfaces and heals and rests. And if your eyes aren't closing all the way, that can't happen. So something like that acts as a lid for you and protects the eye while you sleep is a great idea.
Yeah, that's what I have, lagophthalmos, so I can't sleep without mine. But you're absolutely right. You can't assume that it's just one thing. Okay, we have how do you get medical grade fish oil?
Through your eye care provider.
There you go.
So your optometrist or your ophthalmologist.
Yep. Let's see. Next one. What was the N? I don't have my glasses on. What was the N? Sorry.
Oh, it's another drop, acetylcysteine. That just treats another type of dry eye. We usually get it from a compounding pharmacy.
Is it anti-inflammatory, or is it?
Kind of. It kind of eats away at little filaments we can get on the cornea from different types of inflammatory dry eye.
Okay, terrific. And then we have another one right here. When you're, that's a great question. What is your favorite part of your day when you meet, you're screening dry eye patients, every single patient, right? So when two questions. One is your whole team involved in it? So when the person comes in, is that what they're experiencing? Is the whole team is kind of dialed into dry eye when you're screening them? And then how do you feel at the end of the day when you've discovered the patient, how you can help them feel better, how you can help the dry eye patient feel better?
Oh, well, I get the first part of that question is our entire clinical team is trained in dry eye. So our technicians, they're the ones gathering most of the imaging, and they will oftentimes come up, and even before I go in the room and review those images or screening images with the patient, they'll say, oh, Mr. So-and-so has pretty bad aqueous deficient. I've already started pulling some things for you and some information. So they're pretty good at identifying that. We have a dry eye coordinator who educates patients on the procedures we offer and the treatments we offer and how that works. They review forms with patients, help them set up their series of appointments. So yeah, it's definitely a team effort and a lot of training. But I think that also goes along with why I like to treat dry eye so much is it gives my team a real sense of satisfaction at the end of the day. And while we're doing it, a lot of us all suffer from dry eye. We're looking at screens all day. We know everything that we recommend to our patients, from a fish oil to a tranquilized mask or IPL. We know everything we're offering is effective because we see it work all day long. So when we get to share a treatment we know will be successful with a patient who's been suffering for years, we all feel good about it. Smiles around, end of the day, we're like, oh, awesome. Mrs. So-and-so, she's going to be so happy. I can't wait till she comes back. And that just makes it worth it. And that's a big part personally of why I like treating dry eye is it's something I get to fix. A lot of times I'm working with other specialists, we're referring out. And this we get to treat and we get to see people find relief and make their lives a little better.
I love it. Well, I can't thank you enough, Dr. King, for everything you're doing for dry eye patients and everybody out there that is in the area of Rockford, Illinois, or the surrounding area. Please reach out to her. Here's her contact information. Again, Advanced Rockford Eye Care in Rockford, Illinois. And Dr. King, thank you. I just thank you for being here. Thank you for everything. And everybody else, please stay tuned. We have 3 more lined up for the month. For July is Dry Eye Awareness Month. So here's just a sneak preview of what's coming down the path, and that'll also be on our website. But we just are very grateful for everything Dr. King and the other great dry eye doctors are doing out there in the country for dry eye patients. So we'll see you soon, and I hope you all have a wonderful evening. Thank you so much.
Thank you, Suzanne.
Thank you.